morning, ladies. Hope you're having a great day. Today, we're going to be talking about something that can be a fairly common finding on ultrasounds during your pregnancy, and that is called an echogenic intracardiac foci, or EIF for short, if you hear your provider put that way. It is a finding that is approximately about 3 to 5% of pregnancies, and it can be very scary to hear that something is seen on ultrasound in your baby's heart. But first, before we get started, I'm Shannon. I'm a certified nurse midwife, and I have been taking care of women for a long time, and education is imperative to having a healthy pregnancy with decreased anxiety levels. So without further ado, let's get going. First of all, it can be terrifying to hear your OB or your midwife tell you that they see something on ultrasound that is in your baby's heart. Everybody loses their mind. It's scary. It's anxiety provoking, but rest assured, your baby is going to be okay. This is not going to impact your baby's heart. An echogenic intracardiac foci is a bright spot seen in the baby's heart, likely due to a buildup of calcium. It's usually like a speck that is seen that has, like I previously said, no impact on the function of your baby's heart. Now, this spot can be seen in a early or mid second trimester ultrasound, maybe on your anatomy scan. It could be seen in the third trimester. The timing of them varies depending on each woman and each baby. Now, sometimes these spots go away before delivery. Never see them again, no big deal. And sometimes they last through the pregnancy. Your baby's pediatrician may want to follow up after delivery. Now, one thing that can mean is that it could be that your baby's increased risk for having trisomy 21. Most patients, almost every single one of my patients, has genetic testing done to attempt to rule out the likelihood that their baby is high risk for having trisomy 21. Now, if you elected not to do genetic testing and this spot is seen on the ultrasound, your provider may recommend that you actually have this testing done to further rule out that this genetic anomaly can be there. In the setting of completely normal genetic testing and everything else on the ultrasound being normal, is this going to cause your baby any harm, any long-term complications? No. Like I said previously, your pediatrician may want to follow up with the baby afterwards, but there have been no findings that the spot itself causes any complications with the cardiac function, irregularities in the heartbeat, or anything like that. Now, what can you do about the EIF seen on ultrasound? The answer is nothing. You can do nothing about it. It's not anything that is because of what you're doing. You can't do anything to make it go away. You can't go in there and fix it and, make it disappear. What you can do, repeat your ultrasound with your OB or your midwife in 4 to 8 weeks to see if it has resolved. Some patients will elect to go see a high-risk doctor for a second opinion. And I've had patients that have done this, that they get to the high-risk doctor and it's no longer seen on the ultrasound. Then I get the other part of patients that elect to go to the high-risk doctor and they see it. It doesn't grow, doesn't get bigger, and it just kind of stays there. So will your baby need treatment? Kind of touched on this previously. Your baby's pediatrician may elect to do an ultrasound to look at the baby's heart if there's any questions or concerns about it. There may be follow-up, but more times than not, by the end of the third trimester, by the time you get ready to deliver your baby, that is no longer a finding on the ultrasound. I hope this information was helpful in kind of calming your nerves a little bit about this finding. And just make sure you ask your providers if you have questions. Make sure that you understand anything that is seen on ultrasound that may be out of range of what you expect to see or what your provider expects to see. When you get that initial notification that, hey, we saw this on ultrasound, it can be kind of jarring and your brain starts going in 5,000 different directions. Take a deep breath and start, listing your questions. You may not think about them right then. It's okay. You're going to have lots of questions. This is stuff that we deal with every day. It may not be or has never been on your radar and anything that you expected to see or hear. So give yourself some time to process and then follow back up with your provider just to make sure that you have all of your questions and concerns addressed and that you're comfortable going forward with the remainder of your pregnancy. I hope you guys have a great day. If you have any questions, concerns, comments, leave them below so that we can discuss them. Share this video with someone who you know recently had this show up on ultrasound and encourage them to follow along for further education. I hope you guys have a great day. Thanks.